Hello dear students, I am Dr. Ami Raval, your original guru for dental anatomy and dental histology. So let's start with our discussion for NEET GT 12 questions. Coming to our first question. Which of this forms a connection between basal epithelial cells and basal lamina? Is it actin, is it desmosome, is it hemidesmosome or myosin? What will be the correct answer here? So it is asked between basal epithelial cells and basal lamina. So this is the basal lamina and these are the epithelial cells. So they are asking about connection between basal lamina and basal epithelial cells. This connection. It is mainly hemidesmosomes. So between the cells and basal lamina is hemidesmosomes. And if it would have been asked between the epithelial cells, then this would have been desmosomes. So between the epithelial cells, desmosomal junctions, and between the cell and the basal lamina, hemidesmosomes. So hemidesmosomes are mainly between the basal cells and basal lamina. Desmosomes between two epithelial cells. And actin and myosin cannot be the correct answer as both of them are contractile proteins present in sarcomere. Which of the following is seen in aging pulp? Is it increased fibers, increased cellularity, increased vascularity, or decreased calcification? What will be the correct answer here? Increased fibers is the correct answer here. Vascularity mainly decreases, so this is not the correct answer. Calcification also increases, so this is also not the correct answer. So definitely the correct answer is increased fibers. We can see increased fibers in case of aging pulp. Vascularity mainly decreases with aging. Identify the tooth. Is it mandibular canine, maxillary lateral incisor, mandibular central incisor, or maxillary lateral incisor? So rest of them are incisors. And for incisors, we have an straight incisal ridge. So here we cannot see a ridge, we can see slopes present, mesial slope and distal slope. So definitely this is for canine. So it is mandibular canine, right? We cannot see a straight ridge here. We can see presence of slopes here, mesial slope, distal slope. So definitely it is canine as we can see the presence of slope. So it is canine. Mandibular canine is slightly narrower as compared to maxillary canine. Mesiodistally narrower. Identify the structure in the given image. Now this is an image based question. This structure is asked. It is a structure resembling tuft of grass. So which structure resembles tuft of grass? Is it enamel spindle, non-enamel, Hunter-Schreger band, or enamel tuft? So among the given option, enamel tuft is the correct answer here, as it is resembling what? Tuft of grass. So the correct answer is enamel tuft. Enamel spindle is basically comma-shaped structure extending from dentinal, or it is mainly odontoblastic processes crossing the dentino-enamel junction. So this cannot be the correct answer. Non-enamel is mainly intertwining of enamel rods. So this is also not the correct answer as we cannot see any intertwining here. Hunter-Schreger bands, they are light and dark bands. So this is also not the correct answer here. So enamel tuft is basically the correct answer. They extend from DJ towards the surface, covering 1/3 to 1/5 of the thickness of the enamel. They are ribbon-like structures, hypocalcified structure of enamel. They are mainly seen in horizontal section. And what do they contain? Protein, 13.17 kd protein. So these are enamel tufts starting from DJ towards the surface, mainly seen in horizontal section. Time taken for the cells to divide, mature and pass through the entire epithelium is known as, is it shedding time, is it maturation time, is it turnover time, or is it exfoliation time? Basically, the cells migrate from basal layer towards the superficial layer. This process is known as maturation, right? From the basal layer to the superficial layer. It becomes a part of each and every layer at a specific time. This process of migration of the cells from the basal layer to the superficial cell layer is known as maturation, and time taken for this process is known as turnover rate. So, it is turnover time is the correct answer here. So, you can go with turnover time here. So don't get confused. The process of migration of the cells from the basal to the superficial layer is maturation. And time taken for this process is turnover rate. Is turnover rate. Now coming to our next question, identify the stage of tooth development in this given image. So first of all, you can see that there is hard tissue formation here. So hard tissue formation is only seen in one stage of tooth development, and it is advanced bell stage. So you should not get confused in this. Only one stage will show hard tissue formation, that is advanced bell stage. So if you see a hard tissue formed in an image, then it is definitely for advanced bell stage. Here also you can see there is presence of hard tissue here. So it is advanced bell stage. So what happens in advanced bell stage? Under the influence of inner enamel epithelium, here we can, this is our dental papilla, right? So the outermost layer of dental papilla cells, you can see, these are odontoblast cells. This odontoblast cells will start forming dentine. Once dentine is formed, nutritional supply from the dental papilla will be cut off. So now the nutritional supply will be from dental sac. For this, the outer enamel epithelium will be laid down in folds. You can easily appreciate there is formation of folds here. So outer enamel epithelium will be laid down in folds, and stellate reticulum will disintegrate, so that the nutritional supply is directly reaching the stratum intermedium and then inner enamel epithelium. Now, once stellate reticulum disintegrates, nutritional supply will directly reach the inner enamel epithelial cells. These cells then differentiate into amyloblast cells, leading to the formation of enamel. Here we can see the formation of enamel. So, the first form hard tissue is dentine, and then enamel is formed. And this process of enamel and dentine formation is known as reciprocal induction, as the formation of enamel and dentine is interdependent. It is not independent. Both require each other's support for its formation. Hard tissue which is best studied by ground section is it enamel, bone, cementum, or dentine? It is mainly enamel. Enamel contains 96% of inorganic component. So if it is decalcified, then 96% inorganic component will be removed, so we won't be able to see it in decalcified section. So enamel is best studied under ground section. Identify the structure with a question mark in the image. Is it Walkman's canal? Is it lacunae? Is it circumferential lamina? Or is it Haversian canal? It is Haversian canal. Again, an image based question. Haversian canal is mainly the central canal found in the center of the osteon. Osteon is what? Basic metabolic unit of bone. So this Haversian canal is present in the center of the osteon. It contains blood vessels, nerves, lymphatic vessels that supply nutrients to the osteocyte. So main function is providing nourishment and removing the metabolic waste. Odontoblasts are originated from ectoderm, ectomesenchyme, dental lamina, or none of the above. So odontoblast cells form what? Dentine, right? And dentine is formed from what? Dental papilla, right? So dental papilla is mainly a ectomesenchymal structure. So odontoblasts are mainly derived from ectomesenchyme. As ectomesenchyme is involved in the formation of dentine, and which cells from dentine? Odontoblasts. So definitely ectomesenchymal cells will differentiate into odontoblasts, leading to the formation of dentine. Right. So ectomesenchyme is the correct answer here. Ectoderm is involved in the formation of amyloblast cells. As enamel is only the hard tissue which is formed from ectoderm. So amyloblast cells are involved in the formation of enamel. So don't get confused here. We will study here. Ectoderm is involved in the formation of amyloblast cells, which are involved in the formation of enamel. Right? So if enamel was asked, then amyloblast cell would be the correct answer and ectoderm would be the correct answer here. Now coming to ectomesenchyme. These cells differentiate into odontoblast cells, leading to the formation of dentine. This can also differentiate into cementoblast cell, osteoblast cell, and fibroblast cell, leading to the formation of cementum, bone, and periodontal ligament. Right. Now coming to our third option, which is dental lamina. Dental lamina is mainly involved in the formation of tooth, right? Deciduous tooth as well as permanent tooth. Permanent tooth, it can be succedaneous tooth or non-succedaneous tooth. So here, coming to the question, odontoblasts are mainly derived from ectomesenchyme. Enamel rod is formed by how many amyloblasts? So we can see this is our enamel rod. It has two portions, a head portion and a tail portion. Head portion is formed by one amyloblast. And tail portion is formed by 3 amyloblasts. So in total, 1 plus 3 is 4. So 4 amyloblast cells are involved in the formation of one enamel rod. So the correct answer here is 4. So please remember, head end formed by 1 amyloblast, tail end formed by 3 amyloblasts. So in total, 4 amyloblasts. Incremental lines of cementum are Retzius are incremental lines of enamel. So here it is asked for cementum, so this cannot be the correct answer, as striae of Retzius are incremental lines of enamel. Coming to von Ebner, incremental lines of von Ebner are incremental lines of dentine. So again, this cannot be the correct answer. Coming to Salter lines, yes, this is the correct answer here. Incremental lines of Salter are incremental lines of cementum. So correct answer is Salter. So incremental lines of cementum are incremental lines of Salter. Coming to our next question. Physiologic spaces seen mesial to the maxillary canine and distal to the mandibular canine are they primate spaces, simian spaces, anthropoid space, or all of the above? So basically, they are primate spaces which are known as simian or anthropoid spaces. So all the 3 options are correct here. So the correct answer is all of the above. So these are primate spaces which are generalized primate spaces which are mainly also known as simian space or anthropoid space. In this diagram, you can easily appreciate mesial to the, this is canine, right? So it is present mesial to the maxillary canine. This is our midline. So this is towards the midline mesial surface. So mesial to the canine and distal to the mandibular canine. This is away from the midline. So this is distal portion and this is mesial portion. So mesial to the maxillary canine and distal to the mandibular canine. In this diagram also you can easily appreciate. This is canine, this is lateral incisor. So mesial to the maxillary canine and distal to the mandibular canine. You can see the presence of space which are primate spaces, which are also known as anthropoid space or simian space. Coming to our next question, correct exfoliation sequence of maxillary teeth is it A, B, C, D, E? Is it A, B, D, E, C? Is it B, A, D, E, C? Or is it A, B, C, E, D? So it is asked eruption timing? No, it is asked exfoliation sequence, shedding time, shedding sequence, right? So shedding time, as we can see for maxillary teeth, central incisor is 6 to 7. So first is A, then B, then you can go with D, A, B, D, C, E, right? For maxillary teeth. Coming to mandibular teeth, 6 to 7 A, 7 to 8 B, 9 to 12, 9 to 11 and 10 to 12. So here it is asked for maxillary teeth. A, B, D, C, E, right? So for maxillary teeth, it is A, B, D, C, E or A, B, D, E, C. So the correct answer here will be A, B, D, E, C, as it is 6 to 7, 7 to 8, then 9. So definitely D will come after B, then C and E, or E or C. You can here A, B, D, C, E is also correct. But as option is given EC, then you can go with E or C. E and C can be interchanged. C can come before E also, E can come after C also. But D will come before E and C here. First molar will shed before canine and second molar. True about Langerhans cells. Are they G-specific granules, modified lysosomes, ATPase activity or dendritic cell? It is mainly dendritic cell. Here you can see it is a dendritic cell, mainly present in the upper layer of the epithelium, while this Langerhans cell is one of the non-keratinocytes, right? So which are the non-keratinocyte cells? Merkel cells, melanocytes, Langerhans cells and inflammatory cells. So these are the non-keratinocytes. Amongst the non-keratinocytes, Langerhans cells is present in the uppermost layer, while Merkel cell will be seen in the basal layer near the nerve fibers. This non-keratinocyte cells has Birbeck granules. So this is the characteristic presence of Birbeck granules seen in Langerhans cells. They are rod-like granules. So if this type of diagram is shown, it is mainly for Langerhans cells and these are Birbeck granules present in Langerhans cells. This play an important role in antigen presenting cells. So they are also known as antigen presenting cells. Immunologic function. This cells mainly has an immunologic function. Main function is immunologic function.